Welcome back. Today we have diabetes educator at Piedmont Macon, Keri Wilbur, joining us. Thank you for being here today.
Thank you for having me.
I'm excited because we're talking about a really important month, Diabetes Awareness Month. And so I have a few questions. You know, Piedmont Macon is talking about this, and you have a diabetes conference that's lined up for November 13th. Why is this such a big deal that we're talking about this and having this conference?
Correct. Well, currently in the state of Georgia, there are about estimated 1 million individuals that are diagnosed with diabetes. However, that statistic is probably very underestimated because there are probably about 230,000 individuals who walk around with it and do not know yet that they have that. So they're not yet diagnosed. And then we have in Georgia probably about another 2 million individuals who are what we call pre-diabetic, which means if they don't make lifestyle changes, diet, exercise, those types of things, that they will go on to develop diabetes. And in Bibb County alone, 15% of the population have been diagnosed with diabetes.
And that's a large percentage, 15%. Now,
Yeah.
what's the main thing that you want people to know about diabetes? What can you tell us?
Well, you know, a lot of people think it stems just from eating, you eat too much sugar. That's not really what it's about. It's a group, diabetes is a group of diseases that affect how the body utilizes insulin. And so that's one thing. It's not about how much sugar you eat. That's not how you get diabetes. And even though it's not curable, it is a chronic disease. You can still live a very active, very healthy life with that. There are modifiable factors that you can take control of: weight, diet, exercising, smoking cessation, those types of things that will keep you just as active and otherwise healthy as you were before your diagnosis.
All right. Now, getting back to the conference, tell me more about the topics that this conference will be discussing.
Yeah, so we're going to do a little bit of Diabetes 101, just where we discuss the basic concepts of diabetes. We're going to talk about medication management of diabetes that will include oral medications that are often used, as well as insulin, different types of insulins. We are going to talk about probably one of the most important areas of diabetes is the nutritional recommendations and restrictions for diabetics. We're going to talk about the correlations of diabetes with high blood pressure and heart health, because what we see is that those are very closely related. A lot of times people that have diabetes have other comorbidities with high blood pressure and heart problems. We're going to talk about wound care for diabetic patients. And then we have one of our Piedmont physicians, Dr. Lay, who is going to talk about what are some things that when you go to your primary doctor, what should you ask about? You know, what should that dialogue look like so that you are an active participant in your own health care?
And that really is important. The big thing is raising awareness and educating. To find out more about this, you can actually head on over to our website, 41nbc.com.